Hello, everyone. Dr. Nikhil Verma here with another episode of Things I Didn't Learn in Med School. Today, I want to talk about um, a topic that came from my own personal beliefs and something that I believe in, and that's kind of leads into what how we develop our beliefs and how we develop believing in what data we so choose to believe in. For those of you that don't know, I'm really big into the regenerative medicine space. Uh, and I use that term regenerative medicine very loosely because there are some things that are not really doing what people claim they do. So, in other words, there's a lot of bad actors out there. Nonetheless, this is kind of what happened. I was playing basketball. I joined a pickup league basketball earlier this year, and I was playing on Monday night. And I went up for a jump shot. I came down and landed on someone's foot and rolled my ankle pretty bad. I was able to walk. There's a lot of swelling. Nothing felt unstable, but it's immediately swole up. From what I believe, probably got some of the peroneus muscles in the complex behind the ankle where they wrap around the anterior tibiofibular ligament and the calcaneal fibular ligament probably are the ones that are strained, if not torn. I haven't taken any MRIs or haven't done ultrasound yet. I did take some X-rays. Everything looked okay. Um, and ultimately, we started having this conversation with some of my colleagues, and I kind of document some of this on my Twitter feed too. Is that I have a philosophy of not using ice and not using non-steroidal anti-inflammatories for a healing process, and it brings up this concept that we always are taught with these acute musculoskeletal injuries, and let's caveat right here: this isn't medical advice. This is how I choose to deal with acute soft tissue injuries that are not unstable, that are not going to cause more damage if I weren't to wrap it up or do something. So just keep that in mind. We're taught mainly in the healthcare industry to do RICE. Rest, ice, compress, and elevate, and use NSAIDs or non-steroidal anti-inflammatories to help with the pain, which is completely fine. But when we look at the science of how inflammation and how all this stuff works, is we should actually be allowing blood flow, because the blood flow will allow more signaling cells to come in and bring in the macrophages to clean up the blood, bring in all the other growth factors that are needed for an acute injury. The blood, might actually exacerbate into the spaces, and you might have a lot more bruising. But in my opinion, this bruising isn't necessarily bad. This is just how our bodies naturally tend to heal. So when we ice, we vasoconstrict. Obviously, it does take away the pain, which is a good feeling. But when we vasoconstrict, now these blood products can't get out of the blood vessels, and that's the whole purpose of swelling. Secondarily is, we use in this, that's just one mechanism. The other side of the coin is when we're talking about non-steroidal anti-inflammatories, they will decrease the production of, the COX enzyme and decrease the production of prostaglandin E. And again, this will decrease our ability to vasodilate, to get the blood products out into the system, to allow the signaling cells to come in and clean things up. So this is the whole basis of why we do what we do in regenerative medicine. People can go take a look at the MEAT method. I'll look it up real fast what it says. Method. It stands for movement, exercise, analgesics, and treatment. So in this concept, what we're looking for is, quickly, as long as it's not there's no instability, moving that joint, moving that tissue in the range of motion it can move in without discomfort. We want to exercise, so you want to start loading it up, you want to stretch it, use some bands. These are all not going to make things worse to the limitations of the injury. Analgesics. So instead of using non-steroidal anti-inflammatory medications, using something like Tylenol, and these are actually good cases where you might want to use opioid medications for the acute time frame. That's what opioid medications were originally designed for, and that's what they should be used for. Acute musculoskeletal injuries or acute injuries, acutely after surgery, that's the best time to use them, not in a chronic manner. And then treatment. What does that treatment look like? Restoring blood flow. This is where compression can come in handy, but not a full-time compression, but compressing some of the lymphatic fluid out, massages, moving the tissue above the skin, or the skin tissue above the underlying dermal tissue, because it can help stimulate some more blood flow and that kind of stuff. Again, this is all conceptual, based off of what we know on how injury, inflammation, and swelling occur. So that's one concept. The other one is peace and love protocol for injuries, and let me run through that one real fast too. So protection, kind of counterintuitive to what I was talking about, but it says avoid activities and movements that increase pain during the first few days after injury. So for my injury, I'm not going to go jump on it. I'm not going to go run on it. What I was doing was just sitting down, foot elevated, and doing the alphabet with my ankles. And I had a band. I was able to just stretch it very passively, not anything that was super painful. Something that felt like a healthy stretch. Elevation, good. That'll be good. If you can get some of that blood flow out, that'll allow more blood flow to get in. Now that tissue has more ability to expand and get more growth factors in there. So elevation might be something that is good. Avoid anti-inflammatories. I kind of gave that concept, and it also says avoid, I think, compression. Same thing. It reduces the swelling, but in the sense that it pushes the swelling, just kind of like why we wear compression socks, or why we would why we actually have musculature in the legs that relies on the venous system to help push the blood out so that more blood flow can go through. Education, I think that's very key. Working with a musculoskeletal expert. Thankfully, I have training in physical medicine, rehabilitation. I've read a lot of studies. I've worked with a lot of physical therapists. The big thing is I know my limitations. So I wouldn't recommend someone trying this on their own. But since I have access to all these things and have access to the device, it's some interesting. It's just an interesting way for me to approach my injury versus whatever. And then the next thing is load management. Right now I'm 4 days out of the injury, and I'm able to walk fine. I have a brace on. There's just a little bit of pain and swelling. I can't jump on it. I can't run on it, but I was trying to do some body weight squats, and I'm trying to relearn how to get my muscles and ligaments to move into the direction I need to move. Now, of course, before I start my own physical therapy regimen, which will probably happen over the next few days, I want to do an ultrasound scan to see what tissues are severely damaged, minimally damaged, what just has some swelling, and et cetera, et cetera. Optimization. I think this is a big key. I have a colleague, and her son he broke his collarbone playing soccer. Now, ever since then, and this is high school soccer, pretty competitive level. Since then, he hasn't felt comfortable going up for headers close into the box, and and that's fine because of the injury. But we need to learn how to trust our body and be optimistic that our bodies do have this incredible ability to heal, and our bodies are constantly doing things to help us. Vascularization, increasing anything that helps to increase the blood flow, running around. But again, that has to come when you're ready, when your body's ready and can tell you. So for this ankle injury specifically, probably not a good idea for me to run for a while. So I'm going to try cycling. I will try the row machine just to get the blood flow pumping through my body. And then exercise, and that's towards the end, and you're going to get back. Your body might need some modifications for a while. This is when it's a great time to work with a physical therapist that can help optimize things. So I use a kind of combination of those two. I think that it's been beneficial because honestly, after day one, after that first night, I didn't have a lot of pain. I was able to walk around with a little bit of a limp, or antalgic gait for those that want to know what that kind of means. And that just by definition just means that you're not loading. The stance phase of one of your legs is less than the other, but a little bit scientific terminology there for you. But ultimately, this sparked up a conversation with my friends about, you know, why do you do all this stuff? And then we started talking about regenerative medicine, and this is where the bulk of the story came from. Is again, I'm very passionate about this regenerative medicine stuff. I do see a future of where this comes in. I think it has so many bad players in the industry and in the uh, healthcare world that say you can regenerate things and regenerate anything and it'll help, and charging tens of fifteens of thousands of $20,000. And this is all nonsensical stuff that give it a bad name. So I want to clear up some of the air. I think the first and foremost thing that most people say, including my mentor, including a lot of my friends, like there's just no evidence. And that's a very easy thing to say if you don't go look at the evidence. And I say that because the evidence that's usually published are in orthopedic journals who have a reason for them not to want this orthobiologics, which is a better term than regenerative medicine because it's your own cells treating orthopedic musculoskeletal conditions. They don't want these things out there because it might take into their productivity of what they're trying to do. And I'm not saying that they're wrong in believing that, or they don't have a right to feel like that, because I do think that orthopedic surgeons have a very, very important role in the healthcare infrastructure, especially with musculoskeletal injuries that we can't always treat with just injections, or we sometimes can't even treat with regenerative medicine or orthobiologics. But the concept is when I go back with my colleagues that are big in the regenerative medicine space, and we look at these studies, they're just really poor studies. And not to go too deep into it, but they're poorly designed. They pick individuals who may not be the common day individual. They don't check the cell counts. They don't talk about technique. They don't talk about a lot of things that we all are conscientious about when we actually are doing these procedures. And pre-op and post-op treatment protocols, that's very important as well. Are they getting physical therapy before and after their protocols? All these things do matter ultimately. And is it the right patient? How severe is the tear? So that's just kind of one thing to keep in mind. The other thing is when we talk about these orthobiologic studies, we just can't get enough patients to buy into it, meaning we can't get a high enough volume of patients to do the studies for. And that can cause a lot of issues to get numbers. Other problems involved is that we can't get a really true, great double-blind study. I guess you could if you had one physician or one team drawing the blood, spinning it down, but when you're injecting that kind of stuff, at least I think that you kind of know when you're injecting and how painful it is. But nonetheless, these are some of the barriers. And as this conversation unfolded, my colleague said, listen, I am fine with you believing in this stuff, but, where's the data? So then we started talking about, like places like Data Biologics does and Regenix does, is where they have this massive database of their physicians and their practitioners uploading the data. And this data is in a database that can help us find what helps and for what conditions and what concoction and what mixture we're going to do. We're nowhere near where we need to be, but his challenge was like, why don't you hold the regenerative medicine community more accountable? And that's a fair point. I should be. I think that there are a lot of bad players out there, and like I said, I call out a lot of people on this, and I think I should do more. And I think he has a good point. But ultimately, the title of this video is ultimately like, when do we trust the science and when do we trust our gut feeling? Or that's the thesis of this video. I haven't really come up with the title yet. Probably will after it's all done. But it's a great thing to think about, because in the past I used to believe in all this biohacking, all this, I need to wake up at 5 a.m. I need to make my bed. I need to, see 15 minutes of sunlight in the morning so my cells get activated. I need to eat this and all this stuff, like whatever. And then I got really big into biohacking for the musculoskeletal system and getting stronger and getting faster and getting bigger. And then ultimately, what happened was I was done with my residency and I was going into my fellowship, and I had about a month off because I wanted to study for the boards. And that month off, I'd listened to this mind-blowing audiobook called Your Deceptive Mind by Stephen Novella. And I remember walking up and down my neighborhood for my study breaks and listening to this audiobook. And it just blew my mind. Like, these things that I think I knew, I just have no idea about. So that challenged me to go back and read these papers on some of these biohackers out there. And I would read their papers and like that they're quoting in their podcasts or their website. And it's like a study that was done in rats like 4 years ago that never showed any efficacy in humans, or it showed non-clinical determinant benefits. But they would sit here in these podcasts in their books saying like, this shows that by closing your eyes at 14:42 will help you breathe. And they would be so suggestive with what their studies would say. And you're like, no, that's not what it said at all. So that lost a lot of credibility because they're not doing their own research. They have teams that are doing it and pulling in this data. So then I started questioning a lot of things about how I felt, how I thought. And this got me really thinking. Whenever I'm reading a paper, I have to go deep down into the paper and see what were the methods, not just reading the abstract. All right, read the headline, read the conclusion, but it's actually going deep inside that paper and understanding what they're saying. So very rarely do I take a headline just for what it says anymore. When a study shows this, study shows that, or even when we have meta-analysis, like those don't always prove to be the best source, even though we have that hierarchy of evidence, as we so believe. I think where things differ is because I'm so involved and fascinated by the regenerative medicine space, the orthobiologic space. I'm reading different papers that come out to the medical population or even the population in general. I'm also having conversations with colleagues who have had very successful treatment protocols in place for many years. Again, there's a very, very hard way to make that into the data that comes into papers and to read. And I think we're still in the infancy of where we need to take this regenerative medicine space. And I think, in that defense, you could say that about anything. You could say that about light therapy. You could say that about, psychedelics and MDMA for post-traumatic stress disorder and other, neuropsychological disorders. In even depression or anxiety. There's tons of different things that might be helping out, but we just don't know, and it takes a long time to get there. I think the biggest thing is if this is something that fascinates you, is just realize that you are at the close to the bottom of the totem pole. You'll get over that first hill of, okay, I know something about it, great, but now you're actually kind of down below because you don't know anything about it. So that's when you want to go talk to people that have been doing this for many, many years, experts who've been showing reproducible data year after year after year. And that's kind of where I've pigeonholed myself into this orthobiologic regenerative medicine space. Not pigeonholed, but I've put myself in that corner so I can talk to these individuals. I can read the reports they're putting out. And I think that's what's most important for this. And it can be anything. It's the same reason when it comes down to stuff like COVID. It's, at the beginning, I'm not a virologist. I'm not an infectious disease doctor. I, had 16, 30 credit hours of that stuff in medical school. I had a 4-week rotation infectious disease. It's not, I mean, it was a good experience, but that's not enough for me to say confidently about these viral So I'm going to listen to the virologists and the infectious disease doctors that have probably been studying this their entire life. It's the same reason that I had a patient who is getting uh, physical therapy for their shoulder, and they said that their physical therapist, they want to stop. I said, well, why do you want to stop? It's like, well, I have a torn rotator cuff. I'm like, that's not necessarily a reason to stop. There are modifications you can do. So she talks to her primary care doctor. Primary care doctor calls my office, and they say, it's like, well, my primary, I don't think it's a good idea. I'm like, well, with all due respect, you're not an expert in musculoskeletal health. This is what I've done my residency and fellowship training in, and I've been fascinated by musculoskeletal health since high school. Ultimately, it came back to the patient didn't have a good experience with that physical therapist, which is completely reasonable. We don't get along with everybody for a lot of reasons. So now that I know that information, I'm saying, all right, can we request a new physical therapist? Someone that's going to work with her, can modify the treatment protocol. I'm not saying she has to go in and lift 50 pounds, but maybe we get some more manual therapy, get some more modalities, keep that range of motion even passively the best we can. Because all we know that this can help her in the post-surgical realm. And I don't even know if she's a surgical candidate. I never looked at the films. This is just what was told to me. So expertise matters in these things, and it's easy to go down into a rabbit hole of false information, and that's how we start developing conspiracy theories and all that stuff. But I think it's very critical for us to realize how deceptive our own minds can be, how deceptive advertising can be, how deceptive studies can be. In the same realm of a conversation with my colleagues, we were talking about how industry, the reps never lie, right? It's like, obviously we feel the reps lie all the time, and I'm not calling anyone out specifically. I'm not really trying to be argumentative about that point. But what I'm trying to say is the reps are basing everything that they know off the experience they have and the data that they're taught to them from their company. Now, their company is partnering with physicians to help write these papers. Not all of them, and there are independent studies. So I just wanted to make that point. And in Europe, there's usually 5 to 10 years data before they even get to America. So that's always a good place to look if you're looking for new innovative technologies. But yeah, so it's just like, these reps aren't necessarily lying. They're just taught this, and it trickles all the way down to a doctor who might not have the time to go read a medical paper, and they get the bulk of the information from that interaction, and then maybe they go to a seminar or a webinar with that same information, and it's very tailored information just for the physician, or the community that the message is for. Sometimes that's nurse practitioners and physician assistants, and sometimes that's the healthcare community, elderly or chronic pain or whatever it might be, diabetics, people with heart failure. Everything gets tailored to that. And I'm not saying that's a bad thing. We need industry to fund these studies. If you don't think we need industry to fund studies, then you are highly mistaken, because these are massive undertakings, and no one has the time, energy, and effort to get all this together. It's when these studies are interpreted a specific way that it starts to get a little bit dicey. So I used to be like, oh, we can't trust pharmaceuticals because they're all paying for, or we can't trust drugs because it's all paid by pharmaceuticals. I used to be like that. But now I'm realizing, like, yeah, no, maybe there's some merit to all this, because we wouldn't get these medications that can save billions of lives yearly out there if it weren't for these studies. So it's with a grain of salt that you want to look at both sides of all these studies. You want to understand the point of view, and it takes us a lot further to be in a conversation mode rather than like, show me the evidence, and that's your hard stop. Well, that's a great place to start, but how I would probably say this nowadays, like, well, I don't think there's a lot of evidence for that. I'd like to see where that is and where that goes, but that's not just something I believe in right now. And that's at least a way that you're keeping an open mind, because I talked about this in my last video about there were undoubtedly things last year to this date, 127-22, that I was 100% confident about. Thought no, there's no other way in the world. And here I am a year later, I'm like, I was stupid for thinking that. And it's okay to change your mind. That's such an important thing. It's okay. Uh, as we develop and learn, and we find new mentors, we find new people to follow, we find new studies. All these are important things. So I think that's the biggest thing I wanted to say today. I think it was a great conversation that we had, and we all kind of came to this agreement. It's like, I need to hold the regenerative medicine community more accountable, and I'm happily going to do that. And they'll be more open-minded to some of the studies that I do present to them. So ultimately, I hope you guys are having a good year. If you have any questions, comments, please drop them below. Please follow, please subscribe, and please reach out if you want me to talk about any topics. All right, everyone, take care. Have a good day.